Hi, you guys. Welcome back for our daily practice questions. It is day 93, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Now, have you grabbed your spot for the upcoming 5 week intensive review? It starts April 21st and runs through May 30th. If you're looking to be board certified by the summer, you need to jump into this class. I have one space remaining. All right, y'all. Question number one. A 19-year-old male patient presents to the clinic after a fall with playing soccer. He landed on an outstretched and now complains of pain and swelling over his wrist. On exam, you find tenderness in the anatomical stuff box and mild swelling, but the patient can still move his fingers. He is unable to extend his wrist fully, and there is no obvious deformities. What is the most likely diagnosis? Is it A, distal radius fracture? Is it B, navicular fracture? Is it C, carpal tunnel syndrome? Or is it D, radial nerve injury? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So, here the stem of the question states, what is the most likely diagnosis? And what do I always say? If they're looking for a diagnosis, you need to run it back and look at those assessment findings. How are they presenting? What are their signs and symptoms? What is noted on exam? So we have a 19-year-old male that comes in. He fell playing soccer. He landed on his outstretched hands and he's complaining of pain and swelling over his wrist. On exam, you note that you find tenderness at the snuff box and mild swelling. Y'all, this is classic presentation of what? B, navicular fracture, right? Those outstretched hands, wrist injury, snuff box being the place of tenderness and swelling. Classic navicular fracture. All right, question number two. A 35-year-old woman visits the urgent care clinic after she fell while carrying groceries and landed on her wrist. She complains of swelling and pain in the wrist, particularly with movement. On exam, you find tenderness in the anatomical snuff box, but there is no visible deformity or bruising. An initial x ray of the wrist does not show any fractures. What is the next best step in management? Is it A, start physical therapy and advise rest for 1 week? Is it B, discharge the patient with instructions for NSAIDs and recheck in 3 days? Is it C, order a follow up x ray in at least 1 week or consider MRI if symptoms persist? Or D, immediately refer for a wrist CT scan? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question here states, what is the next best step in management? All right, so they're asking the next best step in management. This is a treatment question. I always say you got to run it back and look and see if they provided you with the diagnosis. If they have not, you got to go back a little bit further and get those assessment details so you can determine the diagnosis to know what you want to do with the treatment. But it also says next best step. So meaning we have done something. So what else do you need to do, right? All right, so the diagnosis has not been provided, but based off of the presentation, it's similar to question one, where they're having a tenderness in the anatomical snuff box, and this is classic for your navicular fracture. So the issue is we did an initial x-ray and the wrist doesn't show any fractures, but I need you to remember something. With navicular fractures, you need to wait at least 1 week before doing an x-ray because it typically will not show in that first week. At least 1 week after their injury before you do an x-ray, okay? So C is your best answer. Order a follow-up x-ray in at least 1 week, or you consider an MRI if their symptoms persist. All right, and question number three. A 28-year male patient presents after falling off his bike onto his outstretched hand. He complains of localized pain and swelling around his wrist, specifically over the anatomical snuff box. There is no deformity or significant bruising. You suspect a scaphoid fracture. What is the most appropriate initial treatment for this patient? Is it A, apply a short arm cast for 6 weeks? Is it B, prescribe NSAIDs and apply a thumb spica splint? Is it should say C, um, we're going to change it just because it duplicated this thing. So let's say C, prescribe Tylenol and apply a thumb spica splint, or D, recommend an MRI and start physical therapy. Take a moment and tell me what you got. So look, I messed up this question, but let's work through it anyway. So the stem of the question is, what is the most appropriate initial treatment for this patient? So what do you do first in this scenario? First line therapy. So they're suspecting scaphoid fracture. Now I use this term because I want you to know that navicular fracture, scaphoid fracture, same thing. Know your terms. Do not study in a fashion where you're just going, all right, navicular fracture. I know I need to do an x-ray at least 1 week after injury, and then I treat like this, and then they put scaphoid fracture on the exam, and you're completely confused now because you didn't know that was the other name. So scaphoid fracture, what is our first line treatment for navicular fracture, aka scaphoid fracture, right? And the best answer is B, to prescribe an NSAID and apply a thumb spica splint. Look, I'm trying to give you the answer so much, I put it on here twice, and I'm trying to test your knowledge so much on the scaphoid versus navicular that I screwed up the question. But I hope you still found this helpful. As always, y'all, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. We'll continue through our musculoskeletal questions. I wanted to give you the breakdown so that you know how navicular fractures present, and you know how to diagnose them as well as treat them. But as always, if you need any of the resources that I offer, feel free to give us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I offer is linked in the bio, and if you're looking to book any other one-on-one sessions or any other questions, analysis sessions, or custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.